This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients.
Welcome, everybody, to another episode of PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi. If you're new here, I'm a Med-Peds-trained pediatric hospitalist here at UPMC Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. We have been coming to you since October of 2016, going through the content specifications for pediatric hospital medicine and whatever other topics have come up in the meantime, COVID, etc., we've talked about and kind of brought on experts to chat about. We also, every year, have been doing episodes from the PHM National Conference. Now, before I go further, I'm going to give my disclaimer here. First, this episode is not CME. We are not attaching CME to this episode. So if that's what you're listening to, I apologize. Second, I am on the PHM National Conference Planning Committee representing the American Academy of Pediatrics. So that's a disclaimer for me that I am clearly not objective as I normally try to be for these episodes because I'm on the planning committee. So we have been coming to you every PHM National Conference talking about the conference. We introduce it. We'll usually podcast from the conference, not live, but there. And we're going to do the same thing this year, where we bring on people, talk about what they learned, and even if we have a speaker who really just hit it out the park, a group of speakers, we try to bring them on to summarize what they talked about, what everybody liked so much. We'll be doing the same this year. So this is our initial episode for the conference, talking about what to look forward to if you're going to Florida. I will be there. If you see me, or more likely hear me, because you probably don't know what I look like, because it's a podcast, but we're welcome to say hi, chat. I'd love to meet you, as we always do. So, we are going to talk about the conference with our three conference chairs of the planning committee representing the APA, the SHM, and the AAP. That's the Academic Pediatric Association, the Society of Hospital Medicine, and the American Academy of Pediatrics. We will start with Dr. Michelle Marks. Dr. Marks is a graduate of the Ohio University College of Osteopathic Medicine and completed her pediatric residency in 1996 at Cleveland Children's Clinic. After completing her residency and being appointed pediatric chief resident, Dr. Marks has been on staff at the Cleveland Clinic, serving in both the inpatient and outpatient settings. In 2005, she was appointed chair of pediatric hospital medicine at Cleveland Clinic's Children's. Under her direction, the Department of Pediatric Hospital Medicine expanded to provide services at 4 sites in the greater Cleveland area, staffed by over 25 pediatric hospitalists, advanced practice nurses, and support staff. Dr. Marks is nationally recognized as a leader in pediatric hospital medicine and has worked at a national level with the AAP section on hospital medicine and the Society of Hospital Medicine. Currently, Dr. Marks is the medical director of the Cleveland Clinic Children's Hospital for Rehab, where she's able to use her years of clinical expertise and administrative skills to enrich the lives of the most vulnerable pediatric patients and their families. Dr. Marks, welcome to the show. Thank you for joining us.
Thank you so much for having me today. I'm so excited to join the podcast.
All right. Our next expert guest is Dr. Francisco Alvarez. Dr. Alvarez is the Associate Chief of the Regional Pediatric Hospital Medicine Programs and Clinical Professor of Pediatrics at Stanford School of Medicine in Stanford, California. He is one of the current co-chairs of the PHM Conference Planning Committee, along with being the current co-chair of the Academic Pediatric Association PHM Special Interest Group, chair of the Consortium of Pediatric Hospital Medicine, chair of the American Academy of Pediatrics Council on Quality Improvement and Patient Safety Committee on the Guideline Development, and a member of the AAP COQIPS Executive Committee. Dr. Alvarez clearly is busy. He has been involved in various projects on how to address quality and safety gaps within settings that care for pediatric populations, such as the recently updated PHM Choosing Wisely and PHM Core Competencies. He's a contributor and current editor of the AAP Evidence-Based Clinical Practice Guideline Development and Implementation Manual. Some of his work has been published and presented at the Pediatric Hospital Medicine, Society of Hospital Medicine, and Pediatric Academic Society conferences. Personal interests include ways to improve pediatric quality and safety within adult settings, leadership skills, developmental education, and the role of pediatric tertiary centers in providing pediatric health within their surrounding regions through public and private affiliations. Dr. Alvarez, thank you for joining us.
Well, thank you for having me. Glad to be here.
And last but certainly not least, Dr. Jorge Ganem. Dr. Jorge Ganem is a pediatric hospitalist at Peace Health Riverbend Medical Center in Eugene, Oregon. He's an award-winning educator and graduate of the AAP's Advanced Pediatric Educator APEX program. Excellence, pardon me. He serves as the chair of the AAP section on Hospital Medicine's Task Force on Diversity and Inclusion. Dr. Ganem is a leader in quality improvement and in efforts to promote diversity and inclusion. Dr. Ganem received his medical degree from the University of New Mexico School of Medicine and completed his residency in pediatrics at UCSF Benoist. I've never knew how to say that correctly. Say that again?
Benioff.
Benioff. I said that incorrectly. Thank you. Children's Hospital, Oakland, where he also served as chief resident. Dr. Ganem, thank you for joining us.
Dr. Tarchichi, thank you so much for having us on. It's a pleasure to be here.
All right. So let's start with Michelle, Francisco, and Jorge. We'll go around the horn, which is a show on ESPN that I do still love. Michelle, we'll start with you. Tell me what you're most interested about for the conference this year, what you're most looking forward to.
Well, I'll tell you what, Tony, the thing I'm most looking forward to is actually seeing all of our people again in person. It's been a long 2 years, and I know that everybody's really excited to get back and meet with their colleagues and get to reinvigorate the community in a live sort of setting, which is just great. I can't wait. The other thing I'm really looking forward to is that we have a lot of late breaking sessions, which I think are really awesome and are going to address a lot of the issues of the day that our community has been talking about. There's going to be sessions, late-breaking sessions about hepatitis and the hepatitis epidemic in children that's going on. A discussion about drugs and fentanyl and how that's affecting our pediatric community. There's going to be gender equity topics as well as several advocacy topics and discussing how we are able to participate in the narrative that is going on. So we're really excited. I'm really excited about all of these things.
That does sound great. Francisco, same question.
I'm just kind of adding on to what Michelle added. One of the main things, we haven't seen, I keep counting. It's like, well, it's been it's 2 years, but actually it's been 3 years since 2019. So it's like a really long time since seeing everybody. And I feel not only is the conference, we definitely, are very intentful about trying to, address all of the interest and content that everybody on the listserv. We went through the whole list of what everybody wanted, and we were trying to very mindful to cover every topic that's important, but also that we felt at the time, ranging from, what Michelle mentioned, from equity, but also mental health issues, and also kind of like, an aspect of how to be more advocates when it comes to, your local groups and so forth. But I always feel like, in a conference, especially now that it's been 3 years, you get so re-energized every time you're not only around your colleagues, but also when you learn new things. And then when you leave the conference, you come back, with this extra energy that kind of gets you through, through the year. And especially now with everybody through, COVID and, feeling, burnout from all the challenges, in various areas from social all the way to, the COVID pandemic. I think PHM conference is kind of one of those conferences that re-energizes to kind of go back to where you work and feel like, well, I'm not alone, and I and this will help me carry me through the year until ideally the next year or maybe the next conference if it's earlier.
Yeah, motivation and inspiration is always great. Jorge, same question.
Yeah, I echo my colleagues. I really feel when I come back from national meetings, very invigorated to address a lot of the questions that we face locally at our institutions, a lot of the opportunities that we have to explore collaborations with other colleagues across the country. And so meeting in person and being able to see old friends, make new friends, and explore those opportunities to collaborate is really one of the most exciting things that I'm looking forward to. We also have the opportunity to meet learners. There's lots of learners that come to our meeting from students, residents, and of course our PHM fellows. And so an opportunity to listen to what the next generation has to say, learn about new projects and new ideas, and also provide the opportunity to mentor others is really, really exciting. And the conference itself, like my colleagues stated, I think I'm very excited about our featured speakers who we're very thoughtful and deliberate in what we wanted our speakers to address. A lot of the topics that our community has been clamoring to hear about. I think we're very fortunate to be able to recruit amazing, talented speakers who are really going to teach us so many things. We're going to have a session on anti-racism and dismantling racism in medicine. We will have a session that addresses advocacy for patients, families, and our colleagues who are members of the LGBTQIA+ community. We will have a session, a featured speaker addressing the current pediatric and adolescent mental health crisis and what our field of PHM can do to make a difference, as well as the difficulties that our field is facing as far as burnout and what it really means to be a clinician during a pandemic and during the other challenging crises that we're facing. And so I feel that with these amazing four featured speakers that we've been fortunate to recruit, we will have amazing content that everyone can walk away with new ideas, with the strength to continue doing all the hard work they've been doing the last 3 years.
That's great. Yeah, our guests, our plenary speakers, I am also very, very excited about. But let me ask the three of you this. For, not all of us who do pediatric hospital medicine can come to the conference, or there'd be a disaster at the pediatric hospitals with no one to take care of the children. So some of our colleagues have to stay around. Is there an opportunity for them to purchase the conference, some of the sessions after the fact that they can listen to at home?
Yes. This is Michelle, and I can handle that question. We are very excited that the Society of Hospital Medicine is able to offer on-demand sessions. So there will be an on-demand component, and it will be available for purchase as soon as the conference is over. And we're excited that it will be the clinical quick hits that will be highlighted. So there will be a lot of really great clinical content for everybody to take advantage of after the conference is over.
Now, one of the things that is new as of last year to PHM is the PHM stories, where people can discuss whatever personal thing they want to discuss about their career, their lives, anything. Just to open a conversation about things that we all go through. I mean, just regular stuff, in addition to the challenges of being a physician. That's still going on. Can we talk about that a little bit? Does anyone want to discuss that?
I'll take a go at it. I think, the thing that this kind of was brought up, and I want to give credit, and if I recall correctly, Dr. Myrna Giordano kind of brought this up as a new plan for last year's conference when everybody was struggling through COVID and, burnout and isolation and so forth. How to really bring those, true to life stories, not always related to medicine, but really what people are struggling with themselves or stories they've heard from their patients and so forth. So I think it was like a nice way to for people to speak about not only their own struggles, but also a way to heal and a wellness component that we wanted to add to last year's conference. And it had such great reviews and impact to a lot of people that we felt that definitely would like to continue not only for this year, but hopefully for the upcoming years as well.
Francisco, I think you did great with PHM Stories. The only thing I wanted to add as far as PHM Stories is that PHM Stories is going to take on a video format. We're really excited that actually some of the storytellers will be able to join us in the rooms. It will be available for people to, talk about, to directly talk about their stories in a more personal way during the sessions. And we do know that these sessions were really well received, so we're really excited that the new format will be in sort of a very casual sort of type of format. So we're really excited that people will join this and be able to see these stories.
So for those people who are go to these conferences looking for clinical information, stuff they can use to expand their practice and taking care of patients at the bedside, in addition to everything we talked about, I'm excited about a procalcitonin talk that's coming. But Jorge, what are you most excited about for clinical talks?
You know, Tony, I think one of the reasons our conference is such a great place for clinicians to come expand their knowledge base and learn what new things are being done across the country. The backbone of our content is really our community. We really are grateful for all our colleagues who submitted content, because this conference really is highlighting everything that our colleagues across the country are doing. The exciting thing about our conference is that as pediatric hospitalists, we reflect the diversity of clinical practice that our field takes on in different settings. And so we have lots of content for those of us who see neonates in our hospital. So our content on neonatal hospital medicine is robust, and I think we'll be able to offer great clinical content, great hands-on experiences and learning. We'll be addressing new evidence and up-to-date recommendations on the care of newborns. The same for our colleagues across the country who practice in community hospitals. There's lots of content that's specifically dedicated to community pediatric hospital medicine. And of course, there's lots of content for like you said, Tony, for new developing topics such as, the use of procalcitonin in clinical settings, the use of, POCUS, or for point of care ultrasound use. Those are just some examples, but I think the clinical content is robust, diverse, and will really be available for all clinicians who practice in many different settings, highlighting the strengths of our field.
Well, that was great. And no talk about PHM22, I think, would be complete without bringing something up about Disney. Is there anything you guys are excited about going to Disney for?
Definitely not the weather, but beyond that.
I agree. It is hot.
That is so true. I could stay home and have the same weather, though, so I don't know.
Unless Disney has some magic on climate change, but I doubt that. No, it's Disney. I mean, I think everybody's kind of bringing in their family. I think the location, where we're at, I think it's, ideally located, close to Epcot for people who want to, and then there's the boardwalk across where people can go for dinner or drinks if they want to do anything. But I think it's a nice area where, you really don't have to go beyond where location of where the conference is at to really do stuff that's entertaining for, with your colleagues or also especially with your family. So I think, from the location itself, it's definitely one of the ones that I think many people look forward to. Ideally not in the summer, but I think it's just, the nature of when the PHM conference timing is.
As far as what I'm looking most forward to is, I'll be honest with you, I think Disney actually has amazing restaurants, which is surprising to, I think, a lot of people, but I'm really looking forward to going to the Under the Sea restaurant specifically at Epcot, because it's one of my favorite all time. But there's, I think, really a lot of great food offerings at Disney. And I'm actually looking forward to going to the pool.
Okay.
Very excited about
yes.
the pool.
Jorge, anything
Tony,
you're excited about?
Tony, I'm looking forward to the 5K on Friday. It's not only a fun way for all of us who are interested to get together and show off our athletic prowess, but it is actually the registration fee is part of it is going to an excellent organization called Zebra Coalition, which does excellent work in providing services to children and adolescents in the LGBTQIA plus community. And so I think if you are looking for something outside of the meeting space, but that also will benefit a great cause and will be a good meeting new friends and networking event and having fun out on the 5K course, I would highly recommend it.
I was going to
Francisco.
say, I was hedging on that because at 7 a.m. is, for you and I, it's 4 a.m. here. So, but you maybe you sold me on that. We'll see.
I'm already halfway through my run by that time usually.
The other thing I would I would like you to add to this, Tony, is I would really like people to think of it as a walk. So if you don't feel like you can run, I do believe you also could walk, and that's what I plan to do. So please join us, even if you don't feel like you can run.
I think that sounds great. A nice walk. It's going to be early, it's going to be hot, but by gosh, just walking with your friends is a nice idea.
Yep.
Now, we are running out of time for this episode. It's going to be a short episode. I wanted to say, putting together this conference every year is a tremendous amount of work. You three have chaired the conference planning committee, and I have been on it, and it is a lot of work all year long. It's a voluntary thing you're doing for the benefit of all of us in PHM, and I want to say thank you, with the caveat, again, for those listening, I'm pretty honest about things. I will be one of the 3 chairs for next year's, so I'm not trying to pat myself on the back ahead of time. I am genuinely saying thank you to the 3 of you for all the hard work you did.
Thank you. And thanks for being on the committee, and thanks for joining us on this podcast. Looking forward to seeing everybody next week.
Now, typically with these episodes, I give our guests one last chance to add anything in that I did not discuss that we wanted to bring up. Jorge, I'll start with you, kick it out to Francisco, and then Michelle. Is there anything we didn't bring up that you wanted to talk about?
Tony, I know you said one, but I'm going to say 2 quick things. The first one is just a big thank you to all our colleagues who submitted content. Again, we are dependent on you for our conference really being what it is, a highlight of your work. So I just want to say thanks to everyone. Thanks to everyone who reviewed content. That really makes our job so much easier. And then just thanks to all the other members of our planning committee who do an amazing job. And thanks to this year, our staff members from the SHM who supported us and really did a lot of hard work. The second thing I want to say is this conference this year really highlights a lot of amazing work being done in the DEI space. We have a lot of submitted content from our colleagues across the country that highlights their work in diversity, equity, and inclusion. We also have amazing submitted content and planned content to continue exploring the way our field can improve in gender equity. And we have a gender equity forum, and we have a lot of sessions that are highlighting the current state and how we can get better at gender equity, along with addressing equity for our colleagues and equity for children and adolescents and their families who are members of the LGBTQIA community. So I'm very excited about that. Thank you, Tony.
Yeah, so, just to add on what her, I totally, definitely, I really appreciate and grateful to, all the work that everybody, across the country put into not only submitting, but also coming and being active, at PHM for in presentation. But all these people have been active in the past 3 years, with COVID and everything else going on. So it's just highlighting all that contribution and more of like a national stage. So, that we are really appreciative to that. And I've never been co-chair before, but I can't imagine being, having 2 other great colleagues like Michelle and Jorge as co-chairs. They made this, a lot easier than I'm sure it would have been. And we were so fortunate to have a very diverse views and strengths and expertise of our planning committee, including, Tony and others that really made, the work and the content of the conference, really highlighting all of the things that not only are important to our field, but really the different perspectives that I think are needed, especially in the current environment that, we live in. So really appreciate that. And enough can't be said too. Haley, Jade, and another Michelle, not Michelle Marks, they really helped in putting this together. I mean, the amount of work and effort they put into it is amazing. And they really helped in putting, that what we hope would be a great conference together. I think we covered all the issues as Jorge mentioned, and we really, went to looking at how do we make sure where we bring up anything that's important to not only the pediatric hospice field, but the pediatrics in general, ranging from the safety of our children in schools to how to be equitable and, really respecting individual rights and so forth. But we hopefully did it in a way that is not so much political, but educational and constructive for everybody, especially when they go back to their various locations nationally after they leave the conference.
Michelle, anything we forgot?
I don't think so. No. Anyway, I really want to, again, echo what Jorge and Francisco has said about, just thanking the whole community, from the planning committee all the way down to content submitters, abstract reviewers, and everybody else who's actively participated to make this conference great. The other thing I would like to thank is all the PHM story submitters, because those really are very, very personal and very, very heartfelt. And I really want to thank people for putting themselves out there in that way for all of us to, be inspired by, really.
I couldn't agree more. I hope to see you all who are listening there next week. It'll be great. I hope to get this episode out today, ideally. So if you're hearing it, probably it'll be the day I recorded it. And if we bump into you, it'd be so great to chat and say hi. I hope everyone has a safe flight back and forth. And then we get reinvigorated for another great year of pediatric hospital medicine. And we'll have content from the podcast from the conference and afterwards going back to our normal content on different clinical topics and other topics. Thank you all. Jorge, Francisco, Michelle, thank you for being on the show. Really appreciated it.
Thank you. Thank you for having us.
All right. Remember, there's no CMU with this podcast, but we still thank the University of Pittsburgh and Children's Hospital of Pittsburgh and our division, the Paul C. Gaffney division, for supporting the podcast. I'll see you all in Florida. Have a great day, everybody.